all of you. Myself Dr. Yuthika Rao, faculty of Department of Mahatma Gandhi Physiotherapy College. I am working as an assistant professor there. So my today's topic is postural drainage. Basically, I'll just give you a brief description about postural drainage. It is basically a technique to loosen the secretions. So we use basically different positions to loosen out the secretions. So here we go. Definition of postural drainage. Postural drainage, it's also known as bronchial drainage, is an intervention for airway clearance by mobilizing secretions in one or more lung segments to the central airway by placing the patient in various positions so gravity assists in drainage processes. It is effective in cystic fibrosis, bronchiectasis and other pulmonary diseases. Now comes the anatomy of lungs. So we briefly understand the anatomy of lung before starting with the postural drainage. The lung consists of 5 lobes, 3 on the right and 2 on the left of the chest cavity, each of which are further divided into segments. The left upper lobe, it is divided into first the superior division, which consists of the apical posterior segment and the apical anterior segment. Second is inferior, or we can say lingual division also, which contains the superior upper segment and the inferior lower segments. This is the picture showing the interior view with the upper lobe and the lower lobe of the lungs. Left lower lobe again consists of first superior, anterior medial basal, these are the sides, lateral basal and posterior basal. The right middle lobe consists of lateral and medial segments. The right lower lobe consists of superior, medial basal, anterior basal, lateral basal and posterior basal segment. The right upper lobe, the apical, the posterior and the anterior. Now comes what are the goals and indications we prefer to give postural drainage. So our goals are first to prevent the accumulation of secretions in patients at the risk of pulmonary complications. It can be diseases with increased production or viscosity of mucus, then prolonged bed rest, who has received general anesthesia, painful incision causing restricted deep breathing and coughing, and patients on ventilator. For all these conditions, we'll go with the postural drainage positions. Now, second is remove accumulated secretions from the lungs. It can occur in conditions with acute or chronic lung diseases, generally weak or elderly people, or patients with artificial airways. Any disease process in which an abnormal sputum is produced and the patient is prone to recurrent infection, and when the patient is unable to initiate a voluntarily cough or effort to expel the sputum. Now comes the contraindications. Contraindications means in which conditions will not prefer postural drainage. So first is severe hemoptysis, then untreated acute conditions like severe pulmonary edema, congestive heart failure, large pleural effusion, pulmonary embolism, pneumothorax. Then comes cardiovascular instability, cardiac arrhythmias, severe hypertension or hypotension, then recent MI, unstable angina. Recent neurosurgery like head down position may cause increased intracranial pressure, use modified position. So basically in this last intracranial pressure where it is increased, we can go with the modified postural drainage positions. So here is a picture showing what all articles we can use with the postural drainage. First is the proper height in chair that support the hands of the patient, and patient is well seated in this with the proper posture. Second comes the collection cup or sputum cup, we can say kidney tray to spit out the sputum. This is showing glycerine to wash the mouth if patient has vomited and for privacy purposes. This is the pillow to support the patient in different positions, towels and the precursor cups. And with this we also use tilt table if it is available to manage the positions, or if tilt table is not available, we can position the patient either on bed or chair with the pillows. So patient's preparation comes, all the patients do not require postural drainage for all the lung segments. So the procedure must be based on the clinical findings. In postural drainage, the person is tilted or propped at an angle to help drain secretions from the lungs. The lower lobes require drainage most frequently because the upper lobe is drained by the gravity. Before postural drainage, the client may be given a bronchodilator medication or nebulization, or we can also give chest physiotherapy to get the best results in postural drainage. That will also loosen the secretions. Now, postural drainage treatments are scheduled 2 to 3 times daily depending on the degree of the lung congestion. The best time include before breakfast, before lunch or in late afternoon, and best before the bedtime. It is best to avoid hours shortly after meals because postural drainage at these times can be tiring or it can also induce vomiting. So here is a picture showing chest physiotherapy that includes techniques called percussion, vibration and shaking. So to be most effective, postural drainage should be accompanied by chest physiotherapy, as I have already mentioned, which includes percussion, vibration, deep breathing and cuffing. Once a patient assumes the correct postural drainage position, the caregiver performs chest percussion and vibration to the desired area. Now here is a picture showing the postural drainage for upper lobes apical segment. So this is the position of the patient in half sitting position. The patient is positioned by placing the pillow and the therapist is giving the postural drainage. Bed or drainage is flat. Patient leans back on pillow at 30-degree angle against the therapist. Therapist claps marked. There is a marking cupped there with the cupped hands over area between clavicle and top of the scapula each side. Next is the picture showing the postural drainage for upper lobes posterior segments. Bed or drainage is flat. Patient leans over folded pillow at 30-degree angle. Therapist stands behind and claps over the upper back on the both sides. That area is marked, highlighted with the black. Now the other picture is showing the interior segment postural drainage for the upper lobes. In this also, bed or drainage is flat. Patient leans back with the pillow under the knees. The therapist claps between the clavicle and the nipple over each side. Next comes the position 4. It is for the lingula. In this, the body is elevated 16 inch from the foot end. Patient lies head down on right side and rotates 1/4 turn backwards. The pillow may be placed behind from the shoulder and hip with the knees flexed. Therapist claps moderately over left nipple area in females with breast development or tenderness. Use cupped hand with heel of hand under armpit and fingers extending forward beneath the breast. Now comes the middle lobe, that is the position 5. So here we are giving PD for middle lobe. In this, patient lies head down on the left side, you can clearly see in the picture, and rotates 1/4 turn backwards. Pillow may be placed behind from shoulder and hip with knees flexed. Therapist again claps over the right side nipple area, whereas in females due to breast development tenderness, therapist claps cupped hand with heel under the armpit and finger extending forward beneath the breast. This is for the lower lobe anterior basal segments, position 6. Here comes the lower lobe postural drainage for posterior basal segments. The position is mentioned in the picture. Now comes the lateral basal segments for position 8 and 9. Patient lies on abdomen, head down, then rotates 1/4 turn backwards. Upper leg is flexed over the pillow. Lower lobes, superior segment, this is position 10. Patient lies abdomen with hip 2 pillows under the hips. Therapist claps over middle if the back at the tip of the scapula on either side of the spine. This is modified postural drainage. This is given in patients who are not compatible for normal PD posture. Some patients who require postural drainage cannot attain this position or cannot tolerate it. It is given in patients who may not be allowed to attain head down position. It can be neurosurgery. Thank you.